Hello, friends. I'm glad to welcome you to my channel. And today we have a new video format. It's a podcast. And today we have a very interesting topic. It's the consequences of implantation. How to extend the life of implants and what complications can arise from them. And to help us get a professional understanding of this issue, we have the chief doctor and founder of the AMBC clinic, family dentist Mikhail Agami. Misha, hi. The topic of implants is actually really relevant. A huge number of people start losing their teeth over time. And generally, probably after the age of 40 or 50. Just like with the spine, the percentage of people who have lost their teeth increases. So, a lot of people use implants. And let's dive into this topic today. In general, what complications can implants cause? And why?
Well, first of all, we need to separate out who can actually get an implant. And there are certain contraindications to avoid complications in the future. Let's start with the first thing a patient should do before getting implants placed. That's lab tests. First of all, we do blood tests, a complete blood count, coagulation tests, biochemistry, and serology. Basically, for things like HIV and hepatitis. Basically, we're checking for infections. Yes, infections. Next, an EKG is a must, because really, there are certain contraindications that need to be checked. For example, if a person has some autoimmune diseases or diabetes.
Is it often the case that people with diabetes can't get implants?
They can, but there are certain types of diabetes or specific indicators to consider. Yes, let me tell you a secret. Sometimes we have situations where people don't even know they have, for example, prediabetes or even diabetes. They have no idea. So, they only find out about it because they sent in tests, and then they discover they actually have some other issues. Naturally, they go to an endocrinologist or some other specialists, and
they get treated.
Yes, of course, they get treated. So let's start with the main point. There are autoimmune diseases, for example, like rheumatoid arthritis.
Yes, rheumatoid arthritis is quite common.
It's common, and we don't do implantation in such cases.
You can't do it?
We don't do it. I don't want to. I think it's reckless, to place implants. So,
there could be some kind of reaction, right?
These are people who have had cancer and are undergoing chemotherapy. You can't place implants in such cases. There are certain bisphosphonates that they take. Absolutely not, because this can lead to serious complications. There's also systemic lupus erythematosus. That's really serious, yeah? It's severe. Severe, yes. So, there are a number of autoimmune diseases with absolute contraindications, which basically closes the question. We just don't do it. That's the first thing. The second point. Implants are placed as a preventive measure to increase the longevity, let's say, of the work, the existence of the work in the mouth, meaning the construction, or rather, the restoration. I think that's the more accurate way to put it. This is definitely prevention. It's about hygiene and so on. There are main complications that most often appear in any patient, let's say, who has had implants placed after a decade or so. This is periimplantitis. What is periimplantitis? It's some kind of inflammation. Yes, this usually happens because, well, let's put it this way. It's typically discovered during an exam, when we see a sort of capsule, some swelling around the implant. So, there's a bit of inflammation around the implant, just like periodontitis, when the periodontium gets inflamed. Just like around the tooth, an inflammatory process can also develop around an implant. Usually, periimplantitis means you need to clean it out, debride it, and wait, because for it to heal, of course, it won't happen instantly. You have to get rid of all the microbes, right? Yes, that's right, because otherwise you have to wait. The body needs time to recover on its own. The gum closes up, and usually after about 1.5 to 2 months, we can reimplant, meaning we can place the implant again. So this is, statistically speaking, the main complication.
So basically, is it a cyst?
Basically, yes, but not exactly a cyst. A cyst is a bit different. A cyst also has a certain bacterial origin, yes, but it has very clear boundaries. Periimplantitis is actually quite common. So what causes it? First and foremost, it appears because of two main problems. The implants are placed, but you also need to properly fit the prosthetics. There are certain rules, like how deep the crown should be set into the gum. There are clear parameters for this. The deeper the connection between the crown and the implant, that is, with the abutment, the higher the risk of complications with the implant.
You mean this inflammation?
Yes.
By the way, I actually wanted to tell a story. So, one time a patient came to us complaining about his back, but in reality, his back wasn't the real issue. He had a problem. He couldn't conceive children, meaning his sperm were actually very sluggish. And he had already gone through a ton of tests, everything, but still nothing, he just couldn't conceive. So he started thinking maybe something in his back was pinched or something. So we also have a doctor working with us, a preventive medicine specialist, and he looked over all his documents and said, go get a 3D scan of your jaw. You probably have cysts in your teeth. And if there are cysts, get everything cleaned out, and everything will recover in 3 months. And he really did the scan, and my whole mouth was full of cysts. Everything was inflamed. As a result, he got treated and everything. The nerve function was restored. And he comes in like, wait, how is this here and that there? How are they even connected?
Oh, they're definitely connected. They're absolutely connected, of course. Because what is inflammation in the jaw? Well, it's all interconnected in our body. Yeah, so everything gets into the bloodstream, of course. Which is why sometimes when we look at test results, a person comes in terrible shape, their oral health is awful, there's inflammation, gingivitis. And when you check their labs, their ESR is elevated, and sometimes all their reactive biochemistry markers are up too. So there are. And all of this is because of...
Because of the teeth?
Of course. Because if there's inflammation there, how is it any different from inflammation anywhere else? It's not. That's why many people neglect it. They just don't pay attention to it. They always focus on the gut or somewhere else, and so on. Very often, even ENT doctors send patients to us because they say, first, get your teeth treated, and then go to the ENT because it makes sense. So first you need to get rid of the infection, right?
Misha, can you tell us about any unusual cases you've had where something was going on in a person's mouth, but something else in their body was failing and they couldn't figure it out, treating one thing when it turned out to be something else?
I had a case recently. We had a PCR test, and basically, before the surgery, he twisted his ankle, gave him the first sedation, treated him, and his leg got better. I have no idea how that happened.
Yeah, I get it. Now we'll know where to send people. I don't know
how to do that.
I had a patient like that. I sent him for an MRI. He came back and said he felt better after the MRI. Well, maybe the machine worked its magic. Who knows? Maybe.
So,
I don't know. The worst story related to complications is when there's an inflammatory process forming like this. It leads to abscess formation, right? What should you do to make sure this doesn't happen?
Is there any way the patient can influence this? It's important who the orthopedist is, how well they follow the protocol. It depends on the doctor. Yes, of course, it depends on the doctor. Because honestly, the implantologist can do everything perfectly. Put in the implants. Everything looks great. Everything is aligned properly, just right. There are no complications. Everything is fine. But then you go to the orthopedist, and everything needs to be properly fitted, right? That means the load has to be distributed correctly. And maybe something wasn't used quite right, or maybe there's a certain inaccuracy. Again, this brings up the question of digital dentistry, because before, impressions were taken the old-fashioned way, so that it's not just
done by eye, but that there's a precise system with the facial
structure. Whether it's a replica or not, what parts were used, there are actually so many factors involved, so we could spend hours discussing why complications happen. So, to put it simply, you just need a good, proper orthopedist. But
I don't know if they still do it this way, but first they screw a metal bolt into the tooth, and the person walks around with it for months.
You mean the screw?
The screw, something attached to it. That's how it's done now. You can't put the tooth in.
You mean the screws for orthodontics, right? You're talking about something for the tooth. You know, as I said, you can place an implant and load it right away.
Right, like I said, in one day, yeah, in 1 hour. That is, in just 1 hour. So now, basically, when they screw it in and a person walks around with that screw in their tooth, without the actual tooth, basically, that's what happens. That's already a thing of the past, too.
Well, you just need to be clear about exactly what you're talking about right now. If you're talking about the screw that's used for moving teeth, yeah, like when we place. Well, of course, with the implant, we place the implant and load it right away. So even that can be done in just 1 hour. That is, we've already made the prosthesis in advance. Why not? But sometimes it doesn't take. Of course, that happens. Why? We need to talk about statistics, right? 99% of the time, of course, it takes, naturally. Well, sometimes there are reasons why it doesn't take. And sometimes it happens that a person is absolutely fine, perfectly healthy. Yeah, I mean, there are no problems at all. But for some reason, it's an individual trait. Some kind of, I don't know, body reactivity. Why does this happen? I don't know. I have this idea that the older you are, the harder it is for it to take. No, that's absolutely not the case. I know there's a theory that the body's reactivity decreases with age, but actually, everything is absorbed or takes just fine, sometimes even better, as you get older. In fact, the older you are, the better it is. It's kind of a bit of a paradox, right? But it does exist. But actually, I've noticed that, again, it depends on hygiene, how well a person takes care of themselves. After surgery, do they follow the doctor's specific instructions? Because we give a whole list of what you can and can't do, how to behave properly. But some people go to the sauna, then go out drinking. I don't know. There are even some who smoke 2 packs a day, you know? Yeah. That's a risk zone, right? So again, we need to talk about the fact that there are absolute contraindications. And then there's a lifestyle that
turns out affects not just your joints, bones, and heart, but also that area. By the way, smoking.
We completely forgot to talk about smoking, but actually, we missed a really important factor. Smoking has a huge impact on implant integration. With bone tissue, we totally forgot to talk about that. The thing is, patients who smoke automatically fall into the risk zone.
Because their blood vessels are constricted, blood flow is impaired, right? So is that like with coffee? There's no nutrition, no irrigation. The cells don't renew themselves.
That's right, because when a person smokes, to begin with, as they exhale, the smoke hits the mucous membrane, which naturally leads to sclerosis. All those small blood vessels, the capillaries, become sclerotic, and as a result, there's no proper nourishment. There just isn't enough blood supply. And I even know that when we look at those implants that are integrating in smokers, the integration process is different. In other words, it's not complete.
Wow, really?
So this habit actually causes a lot of harm, which is why we always ask, like even in our questionnaire, if you smoke, how much? You could smoke 3 cigarettes or 1.5 to 2 packs. Makes a difference.
Misha, you mentioned that, actually, a lot of people think that teeth get worse in old age, but that's not true. So, could you please tell us about other myths, mistakes, or misconceptions people have that don't match reality?
You know, the very first misconception people have, and honestly, I have no idea where it came from. Every time summer comes around, everyone says, I'm not going to have surgery or get treatment in the summer. I'll do it in the winter. I just think, why? Why? Well, it's hot in the summer, so healing will be worse. What's supposed to heal worse? Do we not have air conditioning? I don't get it. Do they not put in implants in Dubai or something? I mean, what's the connection? That's a myth, folks. Listen, there's no need for that. There's no difference between the seasons. You can do it in summer, winter, fall, whenever. Any time of year. Any time of year, of course. You just need to follow certain instructions and your doctor's recommendations from a specialist, yes. So, what other myths are there? Well, we've already talked about age, right? For some reason, people think the older you are. A lot of people come in and say, yeah, I'm already old. It won't take, right? But people come in at 80 years old, get it done, and it's totally fine. No problems at all. So, about these myths, honestly, people often start telling me, like I came in, I had a CT scan a month ago. Can I get another CT scan? Or maybe I shouldn't because it's radiation. Listen, guys, honestly, your phone gives off more. Is there more radiation? I mean, I think we live in a world where, you take a flight and you get a dose of radiation. Talking on the phone, living in the city, honestly, getting an X-ray, there's a certain amount of exposure. But it's not like a CT scan, like a lung CT. A dental CT scan gives a minimal dose. First of all, it's a small dose. And second, we put on a lead apron, so there's still protection. So if you compare, if you have to choose the lesser of two evils, I think it's better to do an extra CT scan, because waiting a month, sometimes you need to act quickly, but people don't want to do it because they're worried. They think the dose is too high. But that's just a myth.
So, I have a question. As far as I understand, in any case, the result with implants often depends on having a good prosthodontist, a dental prosthodontist. So how do you choose the right one? Well, I was lucky. I came straight to you on a recommendation. But how can someone avoid making a mistake?
We discuss this question quite often. There are certain criteria for a clinic, but first and foremost, ideally, let's put it this way. Ideally, the clinic should have the right equipment. For example, they should definitely have a panoramic X-ray, and it's preferable if they have their own dental lab, so that
Their own lab, yes.
So that everything is made in one place. This
will already speak to the level of the clinic, right?
Of course, it's preferable that the clinic has been operating on the market for a long time. The longer a clinic has been around, the better. That's very important. Ideally also. Well, and nowadays, everything is done through aggregators. We have a great aggregator, Yandex, and there are others. We look at what reviews they have. Sometimes you'll see just 3, 4, or 5 reviews, and it's not clear what kind of clinic it is. So you need to open up the information, read the history, make sure the doctors haven't changed, that the doctors have been working there for a long time. That the specialists have stayed in one place for a long period. That shows the clinic is stable. The doctors stay for a long time, which means they're satisfied.
That means the services are high quality.
The services are high quality. Well, that's pretty obvious. Like Papstanovsky and so on.
You can also read about the doctor afterwards. Of course, you can.
Sorry.
Who I'm making the appointment with.
Yes. Also, by the way, since you mentioned myths, I've noticed this one. For some reason, people are afraid of young guys. I've noticed that. They have this myth that if the doctor is really young. It actually makes sense. I get it. I understand the patients. But sometimes they see a young woman, a surgeon. Oh my God, what, a surgeon? I say, yeah, so she's young. What? Is she supposed to be old or something? I don't get it. What is that?
What is that associated with? So, is that always what people associate it with? It really is a myth.
A stereotype.
A stereotype, yeah. That experience always means time and age. Sure, in some things, maybe that's true, but I know a lot of young guys, like 30 to 35 years old, who are absolute professionals, and they could easily outdo many people in their 50s or 60s with their experience, because those kinds of guys helped me out at your place, right? Yeah, because they're constantly learning, while a lot of people from the older generation, the older age group, they've already stopped, and they're still using the knowledge they had 10 or 20 years ago. I know doctors like that too. So everything works the old-fashioned way. But these guys are already working in a modern way. They have new technologies. They have a new drive for knowledge. I totally agree. It's 100% a myth.
Yeah, that's why the average age at our clinic is actually no more than 40, strangely enough. Even I feel old compared to the guys who work with us. I think you should look at the results, not the age, not the stereotype. Honestly, dentistry in Russia is really top-notch. Overall, we're experiencing crazy growth here.
I've actually heard, tell me if this is true or not, that dentistry in Russia today is one of the leaders even on a global scale.
Yeah, and
I know that people actually come here from Europe. People travel here to get dental services because the quality is top-notch, the prices are super affordable, and even with the cost of the flight, accommodation, food, and dental services, it still ends up costing as much or even less than just the dental work alone back home in Europe. It's clear, there are a lot of things they don't even do there at the same quality as they do here, at least in Moscow. By the way, speaking of myths, actually, I also
thought about it. Everyone always talks about Swiss dentistry. There was a time, really, remember, in the 1990s there was this kind of tourism. Everyone would go abroad somewhere, to Switzerland, to get their teeth treated. It was considered like, I don't know, kind of like a mecca for dentistry. I don't know. I mean, I think that's an absolute myth. These days, our doctors, I look at their work, and sometimes I even come back from there and see what they've done and how they've done it. Guys, seriously, believe me, we're really ahead of the curve here. I've been to many countries, and I can say that our industry is truly very, very competitive and one of the best.
Misha, thank you so much for the valuable information you shared. I actually learned a lot of new things myself. I'll be coming to your clinic soon. It's time for a cleaning.